Good morning. It's Friday, December the 4th, so it must be time for another legislative update from your North Carolina Medical Society. And it's been another busy week, so I want to share with you a little bit about the policy committee that met this week to talk about the 3 policies we asked for your input on: tobacco, equity, and telehealth. Now, tobacco and equity were approved by the policy committee, and you probably read about that in your morning rounds. But the telehealth policy, the committee decided needed some more robust discussions. We're going to continue to work on that. If you have input, feedback that you would like to provide to us, please send that over. We would love to hear from you. We really want to make sure we get this policy right, as we know that telehealth will be a very talked about subject legislatively in 2021, and we know that it is incredibly important to you and your patients. So please reach out to us on that if you'd like to provide us some feedback. Next, another announcement that was made this week was from Governor Cooper and Secretary Cohen on the vaccine distribution plan in North Carolina for COVID-19. Now, in this press conference, it was announced that North Carolina will receive about 85,000 vaccines in our first round. And these vaccines are going to go to frontline healthcare workers and staff who are caring for COVID-19 patients. So I know that includes many of you, so I wanted to make sure I included that in this update, as you may be on the first or at the top of the list to receive this vaccine. Now, in the next round, it will be prioritized for long-term care patients as well as individuals with 2 or more chronic diseases. So we expect to receive more vaccines according to this announcement later in January, but this is just an announcement for those first initial 85,000 vaccines. We'll be sure to keep you updated as we continue to learn more about how this distribution process is going to work. And finally, we did have a joint legislative oversight committee on education occur this week as well. And this was really a discussion from the Department of Public Instruction about what our students have experienced and what the department has experienced in terms of challenges in the COVID-19 environment. Now, I do want to point out what I think is most important to you and your patients is that students really need more mental health services, according to this report from the Department of Public Instruction. If you want to learn more about it and read more about the specific data that was introduced in this committee, be sure to check out our legislative blog. But we're going to continue to follow this very closely, as it will likely come up again in the legislative session in 2021. That's all that I have for you this week. I hope you have a wonderful weekend, and we look forward to talking to you very soon.